Welcome you all. My name is Dr. PJ Madam Rafi. Today we are going to discuss about anti-mania drugs. So first of all, what is mania? Mania is characterized by excessive desire and too much of euphoria. Okay. So mania, obviously patient will have cyclical episodes. That is mania followed by severe depression. In between they will have normal life also. So in mania, what is the major characteristic the difference is here mainly there will be increasing of norepinephrine and dopamine activity. So when enhancing norepinephrine dopamine activity, patient will end up in mania. So the main pathophysiology is not cleared, but recently they find out there will be something elevations of norepinephrine and dopamine level may have enhanced chancing of mania. So we'll fix this one, like increase in norepinephrine dopamine activity may cause mania. Okay. So what is the drug of choice here is mainly lithium. Okay. So here it will not acting on synapse, all those things. Here the main this lithium will have different mechanism of action, that is they selectively inhibit the signal transduction, that is secondary transporters. Okay, these are the secondary messengers acetyl phosphate 3 and diacylglycerol. Okay, these are they inhibit these secondary messengers, thereby inhibit the releasing of this norepinephrine dopamine in the synapse. Okay, so for if we are inhibiting this norepinephrine dopamine in the synapse, obviously patient will have less chance of developing mania. So this lithium drug will have very narrow therapeutic index. Okay, that should be that's why we should be very cautious when you are prescribing this drug, because narrow therapeutic index drugs, they will have more chance of developing toxicity. Which here the MCQ will be focused on what is the therapeutic range. The normal therapeutic range will be 0.8 to 1.4 milliequivalents per liter. So this is the most common frequently repeated MCQ. The therapeutic range of lithium 0.8 to 1.4 milliequivalents. Okay, the dose should be 400 to 600 milligrams. Obviously oral TDS dose will be given. So we will see next how this lithium will act. Okay, this is the normal secondary messenger transport. So it will inhibit this inositol phosphate to ionocetal formation. Okay, by inhibiting this ionocetal phosphate to ionocetal formation, there will be inhibiting releasing of phospholipase C and IP3 diacylglycerol. These two will be needed for releasing of calcium. Okay, this calcium will be helpful for releasing of norepinephrine and epinephrine and dopamine in the synapse. Okay, when you are inhibiting this inositol to inositol phosphate, there will be decrease or there will be inhibiting formation of this secondary messenger diacylglycerol and phospholipase kinase. Okay, by inhibiting this one, there will be obviously there will be inhibition of calcium also mobilization. When calcium is not released, obviously it will not helpful in releasing of neurotransmitters, that is norepinephrine and dopamine into the synapse. So in mania patient, obviously there will be overactivity of norepinephrine dopamine will cause mania. So when this it is inhibiting, there will be decreasing of releasing of norepinephrine and dopamine into the synapse. So patient will have doesn't get chance of maniac symptoms. So what are the therapeutic uses of this lithium drug? Normally we'll use for maniac drug. So mania patients will use. Next, chemo-induced leukopenia, chemotherapy-induced leukopenia, because this lithium will have adverse effects like leukocytosis. So you can use as a repurposing purpose. Okay, repurposing drug. Because chemo-induced leukopenia and agranulocytosis will use lithium. Okay. What are the adverse effects? Major here, if they ask question, they will mainly focus on therapeutic range and adverse effects and what is the mechanism of action. Okay, so mechanism of action will be IP3 DAG inhibition. Calcium will not release, so obviously there will be inhibiting releasing of norepinephrine dopamine. If coming to the therapeutic range, 0.4 to 0.8 to 1.4. Okay, then ADS, if you see the ADS, fine tremors, hypothyroidism will be there, mainly nephrogenic diabetes insipidus. Okay, if you have to remember, my nephrogenic means it will inhibiting antidiuretic hormone, there will be chance of developing nephrogenic diabetes insipidus. One is main adverse effect. Second is lithium will cause diarrhea. Okay, and second is it will aggravate also. How means when diarrhea is happening, obviously there will be losing of electrolyte, that is mainly sodium. When sodium is flushing out of the body, it will allows more absorption of lithium. Obviously when more absorption of lithium will be there, there will further causes diarrhea, then further losing of sodium, then further lithium will be absorbed. That's why it will cause more aggressive diarrhea and it will be very toxic condition. Okay. Next, last will be leukocytosis. Because of this leukocytosis, it is using as a therapeutic purpose in chemotherapy-induced leukopenia and agranulocytosis. Okay. Because of this more major chance of adverse effect, nowadays we are not using lithium. We are going for alternative drugs, that is sodium valproic acid and carbamazepine. These will have less side effect compared to lithium. That's why we will choose these drugs for mania. Okay. Thank you.